Hello everyone, and welcome to the first Talking Tuesday video series that we have created. So in this video, we'll be giving an overview of what Talking Tuesdays are, what the framework is like, what the goals of these sessions are, and then we'll be going over what all 9 sessions will be covering. This video will also include information about the very first session as well. So what are Talking Tuesdays? Really, these sessions are meant to address frequently asked questions regarding coordinated care plans, also known as CCPs, and they are also meant to encourage communication and collaboration between different service providers. In terms of the framework, the target audience is for frontline staff completing coordinated care plans, but feel free to share this with others as that they are interested, or for those that are also going to be contributing to a coordinated care plan. Meetings for these Talking Tuesday sessions will be held bi-weekly, but of course, once the video series are all available, you can watch them whenever you'd like. Each session will be approximately 20 minutes in length, give or take some time, but in this one we'll also be including the overview of what the other sessions are to follow. Before we go into the overview, here are some of the goals of these sessions. So the first goal is communication and really encouraging partners in different organizations to communicate not only amongst themselves, but also internally within their own organization. The second goal is to answer frequently asked questions about health links and coordinated care planning. Next is to provide stakeholders with resources that will be used when involved in the model of care. So this includes anything from consent forms, PowerPoint presentations, to user guides and different checklists. Last goal is to promote sustainability and to really ensure that providers are given the appropriate means of continuing all the amazing work that has taken place to date. So a lot of you are already doing great coordinated care planning and management, but we're here to provide you with the tools to succeed with that. So now we'll be giving a little bit of an overview of what the 9 sessions will consist of. So session 1 is identification and invitation. So this really includes reviewing the target population, the different subgroups and considerations, reviewing the benefits of coordinated care planning and what it means to really have a team-based approach within this care. Language to consider when inviting a client to participate in a coordinated care plan or the coordinated care planning model. How do you know if an individual already has a coordinated care plan? So we'll be talking about the LIN intake, and where you would check in Clinical Connect to see if an existing coordinated care plan is already present. And lastly, we'll review case studies and past client scenarios. Session 2 involves getting consent and what consent forms are actually needed. So this will include reviewing the importance of gaining consent prior to initiating a coordinated care plan, reviewing when to use consent forms and what those forms will actually look like, discuss the stages of change and difficult populations that may be encountered, reviewing strategies and ways to have a discussion about gaining consent, and lastly, as well as understanding the written consent should not be a barrier to proceeding when coordinating care planning. Session 3 is about the roles and responsibilities of the Integrated Care Lead, also known as the ICL, and as well as other members of the care team. So some of the content includes reviewing the roles of the ICL and the care team, but also the client as well, determining who the ICL could be, and as well as, we'll be talking about how you would go about transitioning to a new ICL. And then there will also be a review on the initiation and update form itself. Session 4 looks at the care conference, and this includes reviewing the benefits of coordinated care form from the client's perspective, as well as the care team's perspective, and as well as using the case conference to determining the integrated care lead and care team roles. We'll be talking a little bit about how to identify that on the forums and where you would sort of go about enlisting that. Next is session 5, which is all about goal setting. So we'll be talking about how to align with the client's concerns. So it's in the most important to me section or about the more about me sections. How to help a client verbalize and determine a goal that they may be thinking of. And this session will include reviewing documentation standards for goals as well as the action plan session. So this will include methods to better track progress on goals when multiple individuals are involved, ensuring consistency when collaborating with other organizations, and so forth. In session 6, we'll be discussing sharing the coordinated care plan. This will include reviewing ways on how to share the paper format, explaining why the client should get a copy themselves and the importance of that. We'll be talking about the benefits of HPG or Health Partner Gateway, and how providers can add and edit information in real time to an existing coordinated care plan. So you're able to also add and contribute to information in a CCP that a care coordinator has started. So we'll be talking about that. How to share pertinent information and what communications are considered secure. And lastly, how to leverage care team members that have access to Health Partner Gateway if you're on paper. It's not only about leveraging, but also how to utilize an individual's expertise and knowledge set. So that's where the whole care team part comes together and really fits into the model of care nicely. In session 7, we'll be talking about updating the coordinated care form and what forms are included in the process. That session will include talking about updating the goals and action plan section. So this can either be on paper if you're using a Word document or in Health Partner Gateway if you have access to that. We'll be talking about updating the integrated care lead section as needed or as appropriate. Updating the initiation form, so that's specifically for HPG users only. Updating the care team as needed, and then of course sharing the updates with the entire care team so that everyone is on the same page and is knowing of what is going on in a client's care. In session 8, we will discuss transitions in care. So specifically types of transitions, so for instance, where there's a new integrated care lead and the client's goals are no longer aligning with the ICL services. The client has met their current goals, they've moved, they're currently self-managing, or if they have deceased. We'll also be going through information or completing consent and initiation forms. And lastly, what sharing the information with other care team members will look like. The last session is really about how to maximize primary care communication. So this includes the role of the client's primary care provider in the HealthLinks model of care, when to communicate with the client's primary care provider, as well as methods of communication and billing codes for the family physicians. So this just gives you a little bit of an overview of what all the 9 sessions will be covering. And again, all these will be recorded in the video format so that you're able to go back and review these presentations anytime you wish. So now we'll actually be going into the very first session today, which is identification and invitation. So some of the key takeaways is that the Coordinated Care Plan, also a CCP, coordinates services amongst partners, reduces duplication of services, reduces the number of unnecessary hospital visits, and promotes smoother transitions between different service providers and between different agencies. The Coordinated Care Plan is a client-driven collaboration and communication tool, so really it stems from the client themselves and identifying what is the most meaningful to them. Coordinated care plans outline the goals and actions driven by the client, who is fully involved in deciding the direction of their care. Use your clinical judgment when identifying who would benefit from a coordinated care plan because really you know your clients best. So think about your clients that require multiple services or would benefit from a team-based approach as we currently mentioned. Those clients may have multiple chronic conditions and complex needs that also require coordination of services. So when we're thinking of clients that will likely have multiple service providers involved, stop to think about whether or not they would also benefit from coordination of those services. You can also think about clients that visit the ED often, are admitted to hospital frequently, or those that use healthcare resources unnecessarily because they don't know what else to do and they don't know where else to go for care. You can also identify clients that would benefit from a coordinated care plan by considering those with mental health and addictions issues, those that are frail clients that may require palliative care needs, or those that may also benefit from Indigenous supports. Those that progressive illnesses may also qualify or benefit as well. We also encourage you to look at their social determinants of health because we do know that they really do play a large role in a person's health trajectory. We'll be talking about that in the next few slides as well. And the last slide is finding out if a coordinated care plan is already in place before initiating a new one. And again, we'll talk about that in the next few slides as well in terms of how you can find out if a coordinated care plan already exists for a client. So going into some of the frequently asked questions, the first one is, what are the benefits of a coordinated care plan? So it's really important just to mention, sort of starting out, that it's important to look at this through the lens of the client and really what matters most to them, because it is a client-driven document. So some of the other benefits include standardized communication and collaboration between the client and the care provider. And then the goals, roles, and responsibilities are clearly identified in this document. So this is, sometimes we see duplication of roles, duplication of responsibilities, but this document and really outlining the different roles helps to identify any gaps that may be existing and who is supposed to be taking care of which specific aspect for the client. So who would benefit from a coordinated care plan? So this is really the old model that included those individuals with 4 or more complex chronic conditions, an individual who has visited the ED 5 or more times in the past 12 months. 3 of those emergency department visits would have had to have resulted in admissions, those that are palliative, frail, or have mental health issues. So really that was sort of the older model, but it didn't take into account the preventative model of care. So this is sort of the more reactive approach when individuals were sort of hitting their crisis point and coming to the emergency department. But again, it didn't take into account the social determinants of health and other aspects of it. So we'll call this the outdated model. Some individuals are still, or organizations are still practicing this, but for the purpose of coordinated care management, we want to focus on the bigger picture of things. So leaving that to the side for a moment. Answering the question again, so who would benefit from a coordinated care plan? Again, we've mentioned some of these points. So clients requiring coordination of multiple service providers. So this can include specialists, allied health professionals, primary care, and so forth. Clients with multiple chronic conditions and complex needs. So this includes, but is not limited to, mental health and addictions, frail, elderly, palliative, and those with progressive illnesses. Clients that would benefit from a team-based approach to care and having all of that expertise really come around the table to work together as a group. Clients that require use of healthcare services. So this can include the emergency department, home and community care services, frequent primary care visits, and many others. And lastly, clients are impacted by social determinants of health. So for instance, food security, transportation, financial issues, social isolation is a big one, and family and community supports, just to give you a few examples. So moving on to the next question. So how do you know if a client has a coordinated care plan? So option 1 is to ask your client if they have a coordinated care plan. Sometimes they may know themselves. And if so, ask them to share them with you. With the client's consent, you can contact the Integrated Care Lead, or the ICL, to request to be part of the care team. Option 2 is, with the client's consent, contact the LIN intake line. So the number is just listed on the screen there. It's 1-800-810-0000, and ask if the client is using LIN services or has a coordinated care plan that currently exists. If so, you can request to be connected with the care coordinator to discuss the coordinated care plan and again be a part of that care. Option 3 is, with the client's consent, you can look in Clinical Connect. So if there is a little globe icon that appears on the dashboard, then you can click the Home and Community Care icon on the left side of the page. You want to look for the Coordinated Care Plan tab on the very top of the dashboard, and then click on the most recent name. And then you'll now have access to the Coordinated Care Plan and can contact the ICL for any more information regarding the client's care. The last question includes, is access to the Coordinated Care Plan in Health Partner Gateway at an individual or organizational level? So this is a question that comes up a lot. And access to a client's Coordinated Care Plan in Health Partner Gateway, or HPG, is granted at the organizational level. So if consent is granted, everyone associated with the organization should be able to access the client's coordinated care plan. To find the client's coordinated care plan, you want to first search for the patient by their first and last name, their health card number, or you can also enter their date of birth. The next step is to select H&HB LIN from the organization drop-down list. And then lastly, the client's coordinated care plan should appear. So that concludes the very first session, and the next one to follow will be session 2. Thank you very much.